the first part, I will touch on human-wildlife conflicts. In the second part, I will talk about methods to mitigate these conflicts. And then in the last part, I will illustrate case studies of wildlife fertility control applications. And then there will be time at the end to ask me questions. So human-wildlife conflicts are increasing worldwide. This is a non-exhaustive list of what these conflicts are, but essentially are economic. They have to do with the economic and the environmental impact of wildlife. And if you don't believe me, this is a good demonstration that they are increasing, because the scientific papers on human-wildlife conflicts increased from about 1520 at the beginning of this century to almost 400 in 2020. So clearly there's a lot of attention to this area, certainly in the academic world, but not only in the academic world. And the species that perhaps embodies best all the type of environmental and economic impact that I worked on for many years is the wild boar. So this is an example of wild boar population trends in Europe in the last 30 years. So this is some work that we did with 15 European colleagues. On the y-axis, you have the number of wild boar harvested or culled by hunters. And on the x-axis, you have the time. And the country doesn't matter, the trend is upwards. In fact, it's significantly upwards for some of the countries. Very similar story for wild boar or feral swine or feral pigs across the world. This is an example of the spread of feral swine that are non-native in the US in the last 40 years. So I believe now there are at least 35 states that have wild boar, but the same is going on in Japan, in parts of Africa, in South America, and so on, certainly in Asia. And just to go back to the previous slide, after we published our work in 2017, 2018, Germany, and just to give you an idea, Germany is about half the area of Texas, culled in excess of 800,000 wild boar in 1 year. Another species, this is native, and beavers, European beavers, are growing across Europe. So in terms of numbers and distribution, this is what beavers are doing in Poland in the last 15 years. So they are growing in numbers and distribution, but their impact is also growing. For instance, in 2019, there were in excess of 600 cases of damage by beaver. And that year, there were about 6 million euros or $6 million paid in compensation for beaver damage. Very similar story for many deer and ungulate. These are two examples from the UK and from Sweden. In the UK, there are 1.5 million deer. There are in excess of 70,000 deer-related traffic accidents. And there are many hundreds of human injuries and fatalities due to these accidents. In recent years, Sweden was paying $450 million per year due to ungulate vehicle collisions. One of the reasons why human-wildlife conflicts, or some would say the impact of wildlife, is growing is that we as humans, we have created the ideal conditions. So we have created more food as urban areas are increasing. We have shelter, we have food intentionally or non-intentionally. We are offering food through crops, through rubbish bins. We are providing shelters in many parts of areas, urban areas. And we are also at least in Europe and in the US, forests are growing. And all the animals living in forests, many of these animals are returning or growing. So populations are growing. If you look at the distribution of people, again, I would say too many people. In that, at least the density of people in Europe and Southeast Asia is very, very high. And this is probably where we are seeing most of the conflicts and where the conflicts will be focused in the future. Something also critical to our talk today is that in 2000, the number of people living in urban areas has surpassed, around the world, has surpassed the number of people living in rural areas. By 2030, 3 people out of 4 in Europe, at least, will live in cities. And this is very important because people living in cities have very little contact with wildlife, but very, very strong opinions on how to manage wildlife. And generally, people don't like killing. I think simply put, people don't support killing. So the attitudes of people that, again, see wildlife mainly through TV programs is a romantic one, very often. And this is just to remind me that some zoos are now housing chickens to show children what a chicken looked like before it became a fried chicken. So again, there's this connection between people and wildlife, real encounters with wildlife, but once again, strong opinions on how animals should be managed. The methods that we have used to mitigate human-wildlife conflicts can be divided into 2 sets, lethal methods and non-lethal methods. And I would like to go quickly through some of the lethal methods before talking about fertility control. So these are examples, again, of animals culled in Germany. I'm using data from Germany because they're very accurate, not because Germany is different from any other country. Certainly not in Europe. And these are the number of raccoons or coypu, nutria, culled every year in the last 15 to 20 years. They are non-native. Both species are non-native. But to me, this is possibly one of the best demonstrations that culling, at least as it is done now, is not working. We're dealing with species that have an opportunistic diet, and this is obviously also applied to wild boar or feral swine, species that have a high reproductive rate, and species that are very adaptable, and have a very adaptive behavior to anything like an urban landscape. This is important because these are the trends in number of hunters of large game in Europe. The reason this is important is that hunters, until very recently, were one of the major factors for controlling wildlife, particularly game species, of course. And so they were an important factor in increasing mortality. The number of hunters in many countries around the world, including Europe, is flat or declining in a majority of cases. So the gap between some of the species that I mentioned before and the numbers culled by hunters will increase year on year. Another way that wildlife is managed is through poison. Second generation rodenticides have been around for a long time, and they're very inhumane. If somebody eats one of these drugs, they will die of internal bleeding. So these are aimed at rodents, generally commensal rodents, and they will die of internal bleeding after a few days. So very, very inhumane. Not a lot of people have cared or are caring about the welfare of these products, possibly because there aren't many alternatives, but a large number of people in a large number of countries now have started caring, mainly because these drugs go through the food chain. So they have been found, for instance, in a large proportion of carnivores, in birds of prey, in invertebrates. And so there are a number of countries that are either banning or restricting the use of rodenticides. Another problem with rodenticides is that in some parts of the world, resistance against rodenticide is growing. And that means that rodenticides, or these type of rodenticides, will be less effective in the future. And finally, an example of impact of native species. This is taken from the UK, where we have 2.7 million of non-native gray squirrels. That's the Eastern American gray squirrel, versus a tenth of native red squirrel. The gray squirrels have a conservation impact because they have managed to displace red squirrels from most of the original area, but also a significant economic impact on forestry. Despite this, when some colleagues, this is taken from Dunn and Marzano, considered public attitude to gray squirrel control and interviewed almost 4,000 people, more than 60% of the people interviewed rated contraception as acceptable, and only 30% rated trap and kill as acceptable. And what we've seen over and over when I was working with squirrels and still working with squirrels, we've seen that people don't like to kill, even people that do it traditionally. There are a number of people that would prefer, if given the opportunity, to use alternative to killing. So in summary, too many animals of some species, and too many is obviously provocative. It means a lot of animals and a lot of species, a lot of people, and the interactions are unavoidable. In parallel with this, we should look at the social aspect of this, or the public acceptance. We used to talk about wildlife management until probably 20 years ago. This turned into human-wildlife conflicts. Conflicts turned into interactions, and now everybody's talking about coexistence. And this is an important element of the debate about how do we manage wildlife. There's a focus on, or there's emphasis on coexistence. But all of this means that we do need publicly supported solutions. So we do have contraceptives that we can use or have been used on free-living animals. And the first ones that I would like to introduce you to are immunocontracceptives. These are vaccines that induce antibodies to proteins or hormones essential for reproduction. They are all injectable, so you have to trap the animal to start with to inject, and one or a few doses will make the majority of animals infertile for a number of years. So we do have some practical applications credible. We also have some oral contraceptives, and here we are referring mainly to the contraceptives or to the drugs that have been registered in some countries as contraceptives. So contraceptive 1, based on 2 chemicals, is effective in rats and mice. It has to be delivered for a relatively long time, and it's registered in the US. And EP1, that is a combination of 2 hormones. Again, is effective in many rodent species. It needs to be effective, needs to be delivered for a few days to maybe a couple of weeks, and is registered in Tanzania for rodent control. We also have contraceptives for birds, and namely for pigeons. And these have been registered both in the States, in Italy, in Belgium, and now the registration is going on in different other countries. And again, they can reduce the local number of pigeons if given continuously, like daily, at least 5 days a week, to pigeons during the breeding season. So I'm now going to the case studies. The first one is the first study I ever worked on fertility control in wild boar more than 20 years ago. In summary, we had 12 animals, 12 control animals. They were all females, all sows, and 12 treated animals, treated with one injection of an immunocontraceptive. 11 of the 12 females treated with this contraceptive never reproduced or did not reproduce for at least 4 to 6 years after a single injection. And then we had to stop the study. And then we find also no effects on the physiology, on the behavior, and on the welfare of these animals. And we found no injection site reaction. So we were pretty happy with the results of this study. We went to the field and we injected a number of free-living animals in England. Many ended up shot dead, so it was very difficult to collect data. However, we could demonstrate that most of these animals had antibodies that suggested infertility, but also that the treatment of pregnant animals was not affecting pregnancy. This led to 2 projects, one on wild boar, one near Barcelona, and one in Hong Kong, and one current project in Italy on developing oral contraceptives for wild boar. And we'll go back. I'm sure I'll have some questions about oral contraceptives. The second case study was led by a colleague of mine, Dave Cowan, and it's about feral goats in the UK. There's a population in Wales of goats that vandalize garden, damage plant communities, are in poor health. However, these animals are a very big tourist attraction. Tourists will travel to this area to see these goats. So culling is definitely not an option. And there are only limited opportunities to translocate or to adopt out these animals. And my colleague demonstrated that 1 or 2 doses of an injectable immunocontraceptive reduced the reproduction of goats, female goats, by 83 to 92% for 4 years. So again, this was a very successful project on an isolated population of animals. Very similar story for a project that I led in Hong Kong with Hong Kong colleagues. Hong Kong used to have too many free roaming cows, cattle. They caused traffic obstructions and accidents. They were aggressive towards people, but these animals are also part of Hong Kong's cultural heritage. So culling was not acceptable. We identified several tens of cattle, ear tagged them and injected them with a contraceptive and a booster within a year. And we significantly decreased the pregnancies of these animals for at least 3 years. So that led us to think that we could apply this method to other free-living livestock, but also to rewilding projects that are growing across all the world and certainly in Europe. And this is mainly applications for when animals surpass either their carrying capacity or their social carrying capacity, when their impact becomes intolerable and people start saying we need to do something about it. 4th case study is in the US, elk. Again, animals injected with an immunocontraceptive. 1 dose was effective for 2 years. All animals at necropsy had a granuloma at injection site, which is a sort of hardened tissue, but there was no evidence of altered locomotion or problems with the welfare of these animals. The 5th case study is very interesting because it's a new concept that was applied, that is being applied in South Africa. And this is, the species is elephants, African elephants. And the idea is that immunocontraception can be used on individual elephant rotational basis to stretch the intercalving interval and decrease population growth rate. The beauty of this approach is that females will be in a rotational basis injected. They will be infertile for a few years. They will return to fertility, and so they will have the possibility of contributing their genes to the population. It just increases the interval between two births. This is case studies about, from New Zealand, and it's about fertility control and disease transmission, namely in possums. The researchers surgically sterilized possums to explore whether sterilization led to a decreased proportion of animals infected with leptospira. And indeed, this was the case. So they demonstrated that fertility control obviously will lead to less frequent mating contacts, and so to a reduction of disease transmission. And the beauty of this is that is without having to reduce population density. This is mainly based on impact on behavior that will decrease the proportion of animals being infected. This is still to do with diseases, but is a project that we did with several colleagues, several modelers, on rabies and fertility control in free-roaming dogs. Rabies vaccination and fertility control. What if we could join vaccination of rabies, against rabies in this instance, with vaccination against being fertile? So dogs are susceptible to rabies, are exposed to rabies, infected, and die. If we add vaccination with a rabies vaccine, the animals will not be susceptible anymore, but they will still produce puppies that are susceptible. So if you look at what happens now, if I add fertility control to the link between vaccinated and susceptible, that disappears. So if we add to a vaccine against the disease, a vaccine against fertility, we can optimize disease control. And the last case study is fertility control for free-ranging horses in the US. Stephanie Boyles-Griffin and I looked at these in terms of what are the number of equids in government facilities, and they are almost 60,000, and they cost about $70 million per year to care for. However, culling is unacceptable because, again, horses are part of the cultural heritage of the US. So this is a trial conducted by Baker et al. One dose of an injectable contraceptive reduced foaling, reduced births for 3 years, and then a booster reduced, again, the proportion of animals giving birth for another 3 years. Many animals had injection site reaction, which could have been a granuloma or a sterile abscess, but there were no effects on ongoing pregnancies and apparently no effect on animal welfare. So if we have, with the oral contraceptives we have, there are still very few, and if we did have an oral contraceptive, how would we deliver it to a species and to that species only? Because many contraceptives will affect multiple species. This is one of the many examples. We don't have enough time, but I would like to bring to your attention this example that is based on the work that I did with my team, where we developed what we call the BOSS, the boar operated system, to deliver baits to wild boar and wild boar only. And the best way to explain how this works is to show you a video. So these are free-living animals in England. This is a heavy metal. The bait here is maize, and it's just plain maize or sweet corn. that in the future will contain or can contain a contraceptive, an oral contraceptive. The animals are yellow. Generally, they're not yellow, but there's a marker around the cone. And the interesting part is that the wild boar is the only species, with very, very few exceptions, that has the behavioral trait of and the intelligence to understand how this system works. And they were pretty quick to learn it. We tested this in Montserrat in the Caribbean with free-living pigs. In Italy, you can see a lot of porcupines around it, because to attract animals, initially the boss is left open, so the porcupines couldn't open it. It was just left open to start with. In the UK, again, no other species could feed from it. We were a bit worried about badgers, because badgers are strong enough. The European badgers are strong enough to lift, and sometimes we had 5 badgers around the boss, but they don't have the ability, or they can't think about lifting this cone, the heavy cone. The only animals that could lift were bears in the US, but certainly not raccoons, for instance. So, and my final point is about targeting populations. When we talk about overabundant animals, we can't think about single animals. We have to think about local populations. And there are now a number of papers coming out, both from my group and other research groups, that suggest that adding fertility control in the case of wild boar and wild pigs to feasible level of culling can reduce wild boar populations faster than culling alone. Very similar story for when we model the effect of fertility control following short-term culling. Eradication of squirrels was achieved in the same time as culling alone, but with lower costs. So why, going back to the title of this talk, why should we invest in fertility control? I hope I have brought to your attention a number of reasons why we should really think about fertility control, not necessarily as the silver bullet, but as one of the tools in the toolbox that we have to manage our interactions with wildlife. The first reason is that there is growing demand for no-lethal methods. And this has been proven by many published papers by social scientists. Lethal control can be inefficient, at least as it is done currently. Can be harmful, and here I'm thinking about poison and things like rodenticides. Can be illegal. You can't go in a city and start shooting animals because you shoot people. So it can be unfeasible in some contexts. Modeling seems to point to the fact that fertility control alone or in conjunction with other traditional methods can help reduce wildlife numbers. Translocations, we could have a full webinar of translocation of problem animals, but in essence, they're a quick fix. They do not solve problems. They can affect seriously welfare, and they can spread diseases. So I don't believe they are an alternative to, or a non-lethal alternative to manage wildlife. We have several papers now that prove or suggest that fertility control may reduce disease transmission. And finally, fertility control can promote wildlife stewardship. In the example that I was quoting before, there are a number of people that would be delighted to contribute to methods that will lead to coexistence with wildlife, particularly if these methods do not involve killing. And these are people that will embrace wildlife management and help and donate their time and energy to make these things happen. So there are a number of people that told us that we're very happy to distribute contraceptives, for instance, because it was in their eyes a better method to resolve the impact of gray squirrels. So when people ask me, When should we use non-lethal methods? I would say when lethal control is either illegal or not acceptable or not feasible or not suitable or sustainable, when it is environmentally harmful or ineffective, or any combination of these. I haven't had time to go through the challenges of fertility control. There are many, many, and I'm more than happy to answer some questions about it. But just some of the challenges are the registration of new contraceptives, the legal aspects of importing and use drugs that may not have been registered in a particular country, welfare aspect, potential side effects on behavior and on population, the feasibility of using some of these contraceptives, the cost, the public acceptance, the potential effects on the food chain and on the environment. The fact that we have challenges should not stop us from considering it, because we should always consider these challenges in a wider context of what are the alternatives and how can we compare the alternative methods with the challenges or with the obstacles presented by fertility control. So in conclusion, I like to say that the future is here. It's critical that we start thinking about these interactions, because human-animal interactions are growing at a rate that is unprecedented. We do need new tools to ensure that these interactions remain positive in a One Health framework, so for the people, for the animals, and for the environment. We need to invest in research, a lot on oral contraceptives, but not only, and in applications of fertility control as a priority. And I would like to leave you, so if you want to look at the frequently asked questions, there's a link at the bottom of the page, at the bottom of the slide, on frequently asked questions on many of the topics that I've touched on today. So please go and have a look at them. But I would like to leave you with an invitation to join us in York in June, where for 2 days we'll be discussing these topics. Thank you very much.
Thank you again so much, Giovanna, for an excellent presentation.
Thank you, Giovanna. And let me add that the webinar was recorded, so it will be posted on our website with all of our other webinars if you're interested. And if you have any questions that you think of after the close of the webinar, just reach out to us. There's an email there available on the front page of our website. So that does it. Thank you again. Thank you, Stephanie, for joining us. And look into our workshop at York if you're interested. That also is posted at our website. Thanks, everyone. Thanks for attending. Bye-bye.